Hello, welcome back to the channel. And thank you once again for choosing the voice of Mzansi, your place for the realest and most important news coming out of South Africa. Make sure you stay till the end so you can see where the information is coming from and try to verify it for yourself. Now, ActionSA has once again stirred the pot and sparked heated conversations across the country. This time, it's about healthcare, specifically, whether undocumented foreigners should continue having access to public healthcare in South Africa. The party has been pushing hard for a constitutional amendment that would restrict full access to only legal citizens and residents, except in cases of emergencies or children in need. Lerato Nobini, the parliamentary chief whip of ActionSA, claims that many public hospitals and clinics are overwhelmed, and foreign nationals make up a large portion of the patients. She argues that it's unsustainable and unfair, especially when South Africans are struggling to get medical attention and the queues keep growing. According to ActionSA, the current interpretation of Section 27 of the Constitution has created a situation where illegal foreigners can access medical care freely, something they believe should be changed immediately. The party says it's not about cruelty, it's about order. If you're in the country legally, you'll get help. If not, emergency care will be the limit. But not everyone agrees. In fact, healthcare workers and rights activists have raised some serious concerns. They're warning that such a move could have dangerous consequences, not just for undocumented foreigners, but for everyone. Imagine someone with untreated TB, COVID-19, or measles roaming around because they were denied treatment. Diseases don't ask for your passport, they just spread. Critics of ActionSA's proposal say healthcare is a public good, something that protects the whole of society. And if people feel afraid to seek medical help because of their immigration status, it might only make things worse for the entire country. Some health experts say instead of pushing people out, we should be focusing on strengthening the public health system, more staff, better infrastructure, and enough medicine for everyone. Of course, there's also a political angle. With the elections always looming in South Africa, some believe this is ActionSA playing to the frustrations of South Africans who are angry about unemployment, poor service delivery, and rising crime. They're saying, South Africans first, but the message walks a thin line between patriotism and scapegoating. Still, others argue that South Africa simply cannot afford to carry everyone. They say many other countries don't offer free healthcare to undocumented foreigners either, so it's not unfair, it's just practical. And let's be honest, our healthcare system is already under serious strain. At the end of the day, it's a very emotional issue. It's about people's lives, their health, and their dignity. But it's also about budgets, systems, and the rights of the people who live here legally and pay taxes. All the images used in this video are only for illustration purposes. They don't represent real individuals unless specifically mentioned. And please, always try to verify what you hear, especially when the topic gets this sensitive. Thanks for watching The Voice of Mzansi. Don't forget to like, share, and hit that subscribe button so you never miss an update. And before we wrap it up, here's a little joke to lighten the mood. Why did the illegal foreigner get kicked out of the clinic? Because even the thermometer couldn't register him. Stay safe, stay sharp, and see you in the next one.